We give the patient the opportunity to get different testings available to them. Nowadays, people are very sensitive to the environment and different chemicals. So we have biocompatibility testings. We draw blood and then we can see what materials your immune system is going to be reactive to or maybe be more compatible. So that way we give you the opportunity to choose from all the dental materials available, which one would be maybe the most compatible to you. So in the year 2000, I was trained for 2 years to learn how to do implants. At that time in history, the only available opportunity to put an implant was titanium. Now as time has evolved, materials have also evolved. And for the last 17 years, we have offered the patients the opportunity to choose a different material, which is called zirconia. So the advantage of zirconia is that it's going to have, instead of 100% metal, it's going to have 0.04% metal. Many dentists say they're mercury-free because they're no longer placing mercury inside a patient's mouth. There's a different kind of dentist that also, not only they do not use mercury, but also they remove the mercury fillings that a patient may have in a safer way. That means that the patient is going to have oxygen, they are going to be using rubber dams, and there's going to be a smart protocol followed with airway and vacuums to protect the patient from getting the toxins from the mouth, bacteria and metals, not to touch the tissues or the patient inhale that into their bodies. Our philosophy in our practice as holistic biological dentistry is that we know that everything is connected. So when you are a fetus and you're developing in layers. From the feet to the brain, everything is going to be connected. That's why women love pedicures, because when you stimulate the feet, the other organs get stimulated. Now in Asia, China, and different countries, they're more familiarized with the connection of the organs and the teeth. But the meridians means that there's a connection between everything in the body connects with everything. So if somebody has like a toothache that is connected to the eye, sometimes the patient said, my eye is twitching. So, or somebody has a toothache that is, the tooth is connected to the lymphatic system. Now people are connecting the dots. So we have patients that never knew that information, and many doctors are getting educated about it. So we're really excited to share with our patients charts of meridians as an educational item. It's more alternative kind of medicine.